We're back live inside Studio 10, and it's time for On Your Health, where we discuss important medical and health topics with the doctors of Florida Medical Clinic, the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And today we're joined by board-certified audiologist Dr. Jody Pianin, who's here to talk about some of the amazing new devices available to folks with hearing loss. Welcome, doctor. Good morning.
So you are a doctor of audiology,
correct,
and that's different from being a hearing device specialist.
Right.
What is the difference between the two?
Well, we are certified either as a master's degree or a doctoral degree professional, like any other medical professional would be. So our focus is much more medically based. When you go to purchase a hearing aid, you can either look at it as a widget that you're going to go buy from a store, or you can go to a healthcare professional. So we are much more healthcare focused.
And you are one of only 1,600 doctors of audiology in the country, right?
For board certification.
For board certification.
Right. There are about 15,000 of us that practice, but only about 10% are actually board certified in audiology by the American Board of Audiology.
Why was this a field that you wanted to go into? Why was it important to you?
I became interested when I was in about 4th grade. Actually learning sign language was something that really intrigued me as a younger child, and then I wanted to integrate it into a career and stumbled upon audiology, and I've been in a love affair with it ever since.
And like so many fields of medicine, your field has come so far in the last few years, mainly because of computer technology. Well, when Rush Limbaugh went through that whole deal where he thought he was going to be deaf,
right,
and they did, what was it called, the cochlear?
He did a cochlear implant.
Cochlear implant.
Right, right. He suffered a sudden hearing loss, a nerve-based hearing loss, and he was able to benefit from a cochlear implant. And typically that's when someone cannot benefit from hearing aids, traditional hearing aids anymore. We can look at cochlear implants as another option.
Let's talk a little bit about some of the technology that's available now in the hearing aids, because I think we all still think of hearing aids in that traditional, the thing that your grandparents used to wear,
you know,
the big tan thing right here, yeah.
But they're almost completely unnoticeable these days.
They're very sleek, and we've gotten much better at microprocessors to be able to make the body of the hearing aids much smaller, but yet at the same time their technology has improved tremendously. So they're, again, little computers for your ears. Just
a news story the other day, I think it was last week, that talked about how a lot of teenagers are setting themselves up for hearing loss because of earbuds, and they keep cranking up the volume. Well,
a lot of people think that the most common cause of hearing loss is age, but really it's noise. And we have about 65% of hearing loss out there in people under age 65. So it is not really an age affliction, it is more noise caused. And with the iPods and other music devices out there, we're seeing a higher incidence. About 8% of kids, of teenagers, have hearing loss now.
Is there a way to fix the hearing loss aside from something like a cochlear implant? If you have, let's say, gone to a lot of concerts and so on and so forth, can you go backward?
Once you cause the damage to the little receptors or the hearing nerve, shall we say, it is typically permanent. There are some hearing losses that are medically treatable, but only about 5% of the time. So when we test someone who has age-related hearing loss or noise-induced hearing loss, it typically is permanent, and that's why we focus our remediation more on amplification.
Talk to us about some of the advancements in the hearing aids. Do you even call them hearing aids anymore? What do you call them now?
Oh, they try to get away from that because of the stigma.
Right.
Hearing devices, hearing instruments, they're hearing aids. But let's love that.
They've got Bluetooth now, and you can hook your phone into them. Tell us about some of those.
Well, we've seen a big push for that need among younger hearing aid users, and because we are fitting more 30, 40, 50-year-olds with hearing aids to get their devices to get along with their cell phones and iPods, we now have the ability to stream or to connect their hearing aids through to the device. So essentially their hearing aids become earphones for the TV, for their phone, and other devices.
That
is wonderful.
Cool.
It's awesome.
Because I never would have thought of that. If you're wearing a hearing aid, you can't put in earbuds.
Not enough real estate there.
Yeah. Let's take a look at this one that you brought, because this is just fascinating. I mean, this thing is tiny, and I'm going to see if our director Jeff can get a shot of this. Is this traditional for them to be this small?
Nowadays we can get that small because of the smaller battery, and we can now fit larger degrees of hearing loss with that style. It used to be only for mild to moderate losses, and now we can go up to severe losses. Wow. And I thought I would show you today that I actually have one.
Oh, wow.
On my ear.
I would never have guessed that.
I can't even tell.
Exactly. And that's our point. A lot of people stay away from the help they need because they have these terrible visual images in their brains of what it's going to portray to other people, that they're weak, that they're old, that they're not as as strong as they used to be. But in reality, they're sacrificing their quality of life by not addressing their hearing problem.
And the quality of what you hear in the hearing aids has gone up as well. I know back in the day, you would hear everything, like you'd hear the background noise and people talking, and it would all be at the same level.
Amplified together.
But it can kind of, they can separate the two now, can't they?
Yes. Now, digital hearing aids overtook the market around 2001, and everything is pretty much digital now. But within the digital class, we have some that are a lot more equipped to handle background noise. The hearing aids are working together as a pair now. They're able to separate out the speech and noise and actually look at the whole room around you as a 3D type of environment.
That's amazing. So how do you alter, let's say that you need it to be louder, how do you turn it up or turn it down?
Well, in order to get the hearing aids this small, we have eliminated the onboard controls of the wheels and switches. So we can do remote control, or typically a patient will just come back and say to me, hey, I need a little boost. We put them back on the computer, we boost them up, and they're ready to go.
That's incredible.
That is fascinating.
I know.
Hey, if you want to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online. Go to floridamedicalclinic.com. While you're there, locate the office nearest you, learn about their doctors, and even request an appointment. Thank you, Dr. Jody.
Thank you for having me.
Nice to see you.
Up next, an organization is hoping to package 250,000 meals for families in Ghana and needs your help. We're going to explain right after the break.
This segment was sponsored by Florida Medical Clinic.